Okay, hello everyone. Welcome to our Q&A session with Dr. Maté. My name is Katsi, and I am joining you today from the traditional, ancestral, and unceded territory of the Musqueam people. I'm currently a research assistant at the UBC Addictions Concurrent Disorders Research Group, and I will be your moderator for today's session. So please feel free to send any questions you have for Dr. Maté through Whova. On the Whova platform, like I mentioned earlier, you should see an Ask a Question button on the bottom right-hand corner of your screen. If you like any questions coming into the Q&A box, please give it a thumbs up and I will try my best to ask the most popular questions first. If your questions do not get answered in our live session, presenters do have the opportunity to type out responses in the Q&A box after the session. As well, if you are experiencing any issues asking questions in Whova, please send your questions through Zoom and I will try my best to read them out as they come in. With that being said, let's get started.
So let me just say, first of all, that with all due regret, I will not be answering any questions in writing afterwards. I just don't have the time. I'm sorry. So what I can deal with here, I'd like to, and what I can't, will have to stay in the box. I'm sorry.
Sounds good. Thank you for letting us know. So to start off our Q&A session, I have one question for you. In what ways do you think the Western ideologies, specifically mind-body duality, hinder the progression of medical practices or prevent patients from receiving trauma-informed care?
All right, let me give you a simple example. A study from Harvard 2 years ago showed that women with severe post-traumatic stress disorder have double the risk of ovarian cancer. Now, if that was the only study ever done, and it isn't, the information wasn't even surprising to me based on other work that had been done. But if that was the only study ever done, that should have sent every doctor running to figure out, well, what's the connection between trauma, stress, and malignancy? And the connections are multiply worked out, documented, delineated, published in hundreds and thousands of research papers. An average physician does not have a clue because it's not part of medical training. So, which also, by the way, the study also showed that women with milder symptoms of PTSD, because of maybe they had treatment for it, they have less risk for ovarian cancer. Now, if that was the only study ever done, and it's only one of multiple thousands, that should tell us that mind and body and emotions, trauma and physiology can't be separated. In other words, we're missing an elemental part of the whole picture. And so when people come with chronic illness, multiple sclerosis, rheumatoid arthritis, any autoimmune disease, fibromyalgia, let alone the mental health conditions, I know from documented studies and personal experience that dealing with the emotional issues can help ameliorate and even cause permanent remissions from a lot of conditions, which only makes sense when you know that mind and body are inseparable. It's miraculous when you don't think that they are united. Let me show you two books. One is called Radical Remission by Kelly Turner. Kelly is an oncological psychologist. Another book called Cured, The Life-Changing Science of Spontaneous Healing by Dr. Jeff Rediger. Jeff is a psychiatrist, physician at Harvard, head of a hospital. Both of these people researched documented cases of what they call spontaneous recovery. In every case, from terminal disease, people that should have died a long time ago and they're still alive. And I know such cases personally, documented them, talked to their doctors. In every case, it was because these people, and I talked to both Jeff and Kelly, and they have they draw the same conclusion, that in every case, the individual underwent a major transformation in their relationship to themselves, and particularly they dealt with their trauma. So we're depriving the population of major tools for healing by separating the mind and the body. And again, I'm not talking about some theoretical airy-fairy new age spiritual connection. I'm talking about the physiologically demonstrated, scientifically validated unity of mind and body. And, and medical practice, medical training completely ignores that. That's just how it is.
Thank you so much for answering that question. So our next question is, what is your response to those who are against harm reduction practices and to those who hold the belief that harm reduction encourages drug use instead of promoting recovery and decreasing the number of drug users?
Well, okay. If anybody on this call has ever met anybody who said, hey, there's a harm reduction facility in Vancouver, I'm going to become a drug addict. If you have met any such person, please come online and share your experience. Nobody becomes addicted because of harm reduction. Nobody. It doesn't encourage drug use. People are already using drugs. The question is, should they be injecting with puddled water from the back alley or with sterile water that we give them? Should they use dirty needles where they transfer HIV from one to the other, or should they use clean needles? Should they be treated like human beings or as outlaws? Harm reduction is not about encouraging addiction. It's about actually meeting a person where they're at. And as much as we hope that they will become abstinent eventually, you can't coerce anybody into abstinence. But until then, we can mitigate the harms of their addiction. And more than that, we can mitigate the harms of backward medical approaches and backward social policies. So harm reduction reduces harm in several dimensions. I can't think of a single argument against it. No study ever showed any deleterious effects. All the studies show positive effects. Again, are we going to practice evidence-based medicine or are we not?
Thank you for sharing your insight, Dr. Maté. The next question I have for you is, how can current healthcare providers create a safe space for youth facing intergenerational trauma?
Well, I was asked almost the same question in the previous session that I was in. In a nutshell, these youth don't feel safe with adults for a good reason. They've been hurt by adults all their lives, beginning usually with being traumatized in their families of origin, and then in the school system, and then in the correctional system, hurt over and over and over and over again. So they don't trust. And why would they? So the first the first and by the way the major step in working with these people is to create trust. And you do that by your attitude, you do that by your understanding, you do that by your compassion, you do that by your presence, you do that with your capacity to notice your own reactions and not act them out on your patients, on your clients, on the youth that you're working with. So it really has to do with how you show up for them. It's in a relationship that you create the safety that they can trust. So that's the big answer to that one.
Thank you so much. The next question I have was regarding something you said at your previous talk. So you mentioned that education systems are misinformed regarding childhood behavior. Given this issue, what tangible steps can we take to improve educational systems?
Well, I never know how to answer questions about how to change systems because you can't change anything that doesn't want to change. Okay. Now, I've had the good fortune of being invited to speak to lots of teachers, thousands of them within the last half year. And when I do, I give them my perspective and they really appreciate it. But they're not educated any more than doctors are or nurses are. So look at this phrase acting out. We talk about kids acting out. Now, when I say acting out, what you picture in your mind is a kid being oppositional, a kid being rude, aggressive, violent, whatever. That's not what acting out means. Acting out means to portray in behavior what you don't have the words to say in language. So in a game of charades where you're not allowed to speak, you have to act it out. Kids are acting out, but what are they acting out? They're acting out their pain. And so all the bullying, all the aggression, all the learning difficulties, all the behavior problems, all the oppositionality, this is about acting out of their pain, which happened in a relational developmental context. So if we understood that, then instead of trying to prohibit, punish, or exclude the behavior, we would be embracing the child with some understanding. That would change the educational system. Now, how do I change the system? I have no idea.
All right, thank you so much, Dr. Maté, for such thoughtful answers. That concludes our Q&A period for this afternoon. On behalf of the Addictions and Concurrent Disorders Research Group, I wanted to thank Dr. Maté and all our participants for joining